Hello and welcome to Unit 14, where we're going to go ahead and discuss hepatitis. Hepatitis is a disease primarily involving the liver. It's the most common liver disease or the most common viral disease worldwide. It can be mild and transient or severe, prolonged, and fatal. So let's go ahead and talk about the hepatitis diseases. So you can have a non-infectious cause of hepatitis or an infectious cause of hepatitis that's a virus. So the non-infectious agents that cause hepatitis would be toxins or pharmaceutical agents such as alcohol, herbal or regular medications, even things like acetaminophen. Things that cause infectious hepatitis are viruses including hepatitis A, B, C, D, E, and G. This is a primary virus that attacks mostly the liver and no other organs, or very little effect on other organs. So let's go ahead and talk about the different types of hepatitis. Hepatitis A is often referred to as infectious hepatitis. This is a disease that is found especially in countries with poor sanitary conditions or overcrowding. It is an RNA virus. In fact, all of the hepatitis viruses are RNA viruses except for hepatitis B. And you can get hepatitis from sexual contact. That's hepatitis A. Okay? It has a short incubation period of about 15 to 50 days, and usually it takes about 30 days from the time a person becomes in contact when they become infected. They get hepatitis A through what's known as the fecal-oral route, and that means that they are basically consuming fecally contaminated food or water of people that have spread the hepatitis A virus. In unvaccinated populations, it's very high in young children under the age of 5. Okay? This is, like I said, associated with overpopulation situations and associated with crowds of people or people who use contaminated water sources. It's an abrupt onset disease and it has a mortality rate of about 0.3%. The antibody that we are looking for in cases of hepatitis A would be anti-HAV, and we're looking for the IgM antibody in acute cases of the disease, and if you have anti-HAV, the IgG antibody, it means that you have immunity to the disease. In the United States, there's about 125,000 to 200,000 infections a year, although the rate in the U.S. is decreasing. This equals about 100 deaths per year. And this type of hepatitis is typically not fatal. Some symptoms that will develop about 28 days after exposure would be high AST and high ALT. Those are some liver enzymes. Also, your bilirubin will be up in your serum as well. It generally doesn't progress to chronic liver disease, and like I said, there is a mortality rate of about 0.1% to about 0.3%. The treatment, if you've been exposed to hepatitis A, is an injection of IgG. In 2001, there was a combination vaccine made of both HAV and HBV, and that was approved, and it is recommended for children. Probably the most common laboratory testing for hepatitis A virus is ELISA testing, enzyme-linked immunosorbent assay. And here we are looking for antibodies to hepatitis A virus. And again, you're going to see IgM increased in an acute infection and IgG increased, but not super increased, but your antibody titer is going to be increased if you're immune to the disease because you've had the vaccination. Other types of laboratory tests for HAV would be complement fixation, radioimmunoassay, which uses a radioactive tag that can be measured. If the antigen and antibody present, they bind, leaving radioactive tag immunoglobulin increased. Okay, but most of the time, the test that is used to diagnose hepatitis A is the ELISA test. Hepatitis B is referred to as serum hepatitis, and it is a very serious viral infection. And the virus that causes hepatitis B is a double-stranded circular DNA virus. It is one of the most common human pathogens and is best known from a form of post-transfusion hepatitis or hepatitis associated with the use of illicit drugs. There is a longer incubation period for hepatitis B. Usually that incubation period is somewhere between 45 and 180 days. It is associated with sharing needles, transfusion, sexual contact, blood and body fluids, and it can go from mother to baby. The incubation period, like I said, is about 45 to 180 days or 4 to 12 weeks. There are about 300 million people that carry hepatitis B worldwide, and about 5,000 people in the U.S. that die every year due to liver disease associated with hepatitis B. Okay? Like I said, the mortality rate is pretty low at about 0.5 to 1%. Those that are at risk for developing hepatitis B would be heterosexual men and women, homosexual men that have multiple partners, infants born to hepatitis B virus positive moms, custodial staff that work with blood and blood products, and then recipients of plasma-derived products or coag factors. Some signs and symptoms of hepatitis B, these run the gamut. They can be all the way from asymptomatic to fatal. Okay? And the viral proteins of importance that we're going to look for would be hepatitis surface antigen, which is the envelope surface protein, hepatitis B core antigen, and hepatitis B nucleocaspid protein, which is hepatitis E antigen. There is a vaccine that prevents hepatitis B virus, and it's treatable with 7 licensed drugs, and you are treating that person for hepatitis B all the way up to a year. Laboratory tests for hepatitis B virus would be things like PCR or polymerase chain reaction, where we actually multiply the amount of DNA, making several copies of that so we can analyze it. Or ELISA. ELISA, we are looking for hepatitis B surface antigen, which indicates an active or acute chronic infection. We're looking for hepatitis E antigen, which indicates high levels of the virus. We're looking for anti-HBC virus, which is the antibody to core antigen, and we're looking for anti-HBs, which is going to be positive if you are immune due to the vaccine. So the primary antibody formed in response to being immune or in response to the hepatitis B vaccine is anti-HBs, the hepatitis B surface antibody. If you have a low titer of this, it indicates immunity to the because you've had the hepatitis B virus series of vaccines. Hepatitis C virus is a single-stranded RNA virus first identified in 1989. The old name for hepatitis C is called hepatitis non-A, non-B, and it's the most common form of post-transfusion hepatitis. About 85% of the people that have hepatitis C are chronically infected. Okay? It is the most common bloodborne virus in the U.S., with 39 million people in the United States affected. It is a major source of hepatitis among dialysis patients. It is transmitted through needle sticks, transfusions, human bite wounds, tattooing and body piercing, and on rare occasions, sexual intercourse. It has a long incubation period of about 2 to 26 weeks, but the mortality rate is pretty low at 0.2 to 0.4%. The World Health Organization estimates that 3% of the world's population has been infected with hepatitis C, and 85% of positive patients become chronically infected. It is curable using direct active antiviral tablets, sofosbuvir, and ledipasvir. Hepatitis C virus is generally a mild disease with an absence of clinical symptoms. Hospitalization is usually not required. But symptoms that people have of hepatitis C virus would be things like jaundice, fatigue, or nausea, and in some cases they can be asymptomatic. There is currently no distinction between an acute case and a chronic case of hepatitis C virus. Now, the laboratory testing that we can do to help diagnose hepatitis C cases would be things like ELISA, where we are looking for the anti-HCV antibody, Western blot. Western blot is also used to identify HIV or to confirm HIV, and PCR, which is nucleic acid amplification technology or other molecular techniques. The anti-HCV antibody is a marker for the infection with people that have hepatitis C virus. Currently, there is no vaccine available for the HCV virus because the virus mutates so readily. Hepatitis D is a small circular RNA virus that is often referred to as delta agent hepatitis. It was first discovered in 1977, and it is associated with blood and body fluids. It's typically found only in people that are already infected with hepatitis B virus, and it has an incubation period of about 20 to 90 days. If you have hepatitis D, it actually increases the severity of the hepatitis B virus, and the mortality rate is quite high at about 20%. One nice thing about the hepatitis B vaccine is that it also prevents hepatitis D. But again, hepatitis D is most often associated with IV drug use, and there are about 20 million people worldwide that have hepatitis D virus. Hepatitis E is a single-stranded RNA virus that was first discovered in 1990. It is similar to hepatitis A in the way that it is an abrupt onset. The virus was only recently identified in 1990, and it has a 15 to 60-day incubation. Okay? The mortality rate of people that have hepatitis E is about 1 to 2%. It's actually endemic in tropical and subtropical countries like India, China, and Africa. The infection is usually the result of poor living conditions or poor sanitary conditions and contaminated water through the fecal-oral route. Hepatitis G was first described in 1996, and it is considered a blood-borne pathogen. About 1 to 2% of blood donors may have this, and it is typically problematic for people who are already immunosuppressed. It frequently occurs as a co-infection with HCV, and it does not appear to cause a clinically important liver disease. The role of HGV seems to be unclear, and there is no specific treatment. The prognosis, however, is good for those that have it. The illness is usually mild and doesn't last very long, and it doesn't cause long-term liver damage. Okay? So, the importance of hepatitis is that all healthcare professionals, including lab technologists and phlebotomists, are considered to be at higher risk of contracting hepatitis. So, it's very important that we understand the concepts of hepatitis and that we wash our hands and that we use universal precautions.